Hello, I'm Dr. Stephen Myers,
And I'm Dr. Leon Katz.
and we're delighted to share with you detailed information about bariatric surgery and what that can do for you.
We look forward to teaching you about the available options to help you get healthier here at Reading Health System.
So let's get started.
This surgery is a life-changing event, not just from the mechanics, the physical part, but the emotional part. It has restored my joy of life. It has given me a whole new outlook on what I will take on, what I will challenge. I feel more self-confident. I feel like I can accomplish more. I don't think you really comprehend how much weight adds to you until it's gone, and you see how much change you can go through. But it's not easy.
Well, before I had the surgery, I had lost weight time and time again and was not able to keep it off. And the weight came back and I would put on not only the weight I had lost, but even more weight. I began to show symptoms of pre-diabetes. I was diagnosed with high blood pressure. I was pre-hypertension. I had sore joints, sore lower back, and lots of medical issues that just made me feel like I was getting older and unhealthy, which made me seek out the Surgical Weight Loss Center.
Welcome, I'm Dr. Stephen Myers, the Medical Director here at the Weight Management Center of the Reading Health System, and it's my privilege to talk to you about bariatric surgery today. One of the questions that's often asked me is, who can have bariatric surgery? It's a great question, and I would just say a simple answer is probably about if you're about 80 to 100 pounds over ideal weight, you're probably a candidate for bariatric surgery. But we actually look at it a little bit more specifically, and we index a person's weight for their height, and therefore if your body mass index is over 40, you meet criteria for these operations. If your body mass index is less, at 35 to 40, you still meet criteria if you have medical problems such as diabetes, high blood pressure, or obstructive sleep apnea. Now, there are a lot of factors that influence obesity. There are genetics. People in India and in China certainly develop diabetes at an earlier time, and obesity has a more serious effect. There are also behavioral changes that affect obesity and environmental changes. Just think about all the supersizing we do of our meals, and all of those influence whether a person develops obesity or not. Obesity is a disease of excess fat storage, but of course there are a lot of things that happen as a result of that excess weight and that excess fat storage. It's a lifelong progressive disease that's potentially life-threatening. The good news is that if you have bariatric surgery, you can actually decrease your risk of dying over the next 10 years by 30 to 40% compared to people of like size that choose not to have bariatric surgery. So although it is a potentially life-threatening problem, the wonderful news is that you can resolve a lot of that problem by having bariatric surgery. Now, also I wanted to talk to you about why you might want to choose our program. I think it's important for you to understand that we have a comprehensive treatment team. We have registered nurses and dietitians and insurance specialists, 2 bariatric surgeons, and lots of people that are here to help you through the process to get your very best result. We also put a premium on compassionate care. We really want you treated with the respect that you deserve. And I know that frequently you have not been treated well by people as a result of your weight, and we want to make sure that you understand that we're committed to treating you with this respect and compassion that you deserve. Also, you're coming to a program that's a very experienced program. We have done thousands of bariatric operations successfully, and people have done very well. And the entire team is committed to your best long-term result. So we're finished with this segment, and we're going to take time for a quick review.